Assalamualaikum warahmatullahi wabarakatuh. My name is NADIRAH AINA binti Muhammad RUSLAN from CS251 4B. Today, I would like to present about my IOT project, which is Pulse Oximeter. You might be wondering why I am creating this project, right? The novel coronavirus that causes COVID-19 enters the body through respiratory system, causing direct harm to person's lung through inflammation and pneumonia, both of which can impair oxygen transmission into the bloodstream. This oxygen deficiency can arise at several phases of COVID-19, not just in severely ill patients on ventilators.
When you breathe, air flows in through your mouth and nose and down your airways. Inside your lungs, the airways end in clusters of air-filled sacs. These air sacs are surrounded by tiny blood vessels. Here, oxygen from your lungs passes into your bloodstream to get to tissues throughout your body. Carbon dioxide is breathed out. COVID-19 is a disease caused by a virus called SARS-CoV-2. The virus infects cells along your airways by attaching to ACE2 and other molecules on those cells. The virus uses ACE2 as a door to get inside of the cells and make more copies of itself. The virus, and your immune system's reaction to it, inflammation, damages the air sacs, causing them to scar and stiffen or fill with fluid. This blocks some oxygen from passing from your lungs into your bloodstream. As blood oxygen levels fall, you may feel short of breath. In severe cases, a ventilator or other support may be needed. Inflammation helps our bodies fight infection, but in some people with COVID-19, it seems to go into overdrive. Researchers think this may be due to the fact that the virus latches on to the ACE2 molecule in order to get into cells. ACE2 helps reduce inflammation, and this effect is lost when the virus occupies it. The result is that inflammation can go awry.
A pulse oximeter can detect how effectively oxygen binds to red blood cells. There are numerous pulse oximeter sensors available on the market today. It was used to measure the heart rate and the oxygen level. The oxygen saturation measurement, known as peripheral capillary oxygen saturation, is used by oximeters to report the blood oxygen levels. So, if someone has a minor case of COVID-19 and is self-treating at home, a pulse oximeter can be useful for measuring oxygen levels and catching how low oxygen levels early. For other cases, hospitals are sending patients home with pulse oximeter that medical staff can monitor from the hospital. But how the medical staff and the doctors want to monitor their patients? The problem statement: patients with COVID-19 may experience a potentially dangerous reduction in oxygen saturation without evident breathing difficulties. Next, without a pulse oximeter, the patient may not realize it or become familiar to how they feel despite very low oxygen levels. When patients arrive at the hospital complaining of shortness of breath, their oxygen levels will have dropped dramatically and they may have extremely advanced COVID pneumonia. Next, patient COVID-19 does not know when the right time to go to the hospital for further treatment. And then lastly, the hospital cannot monitor from far how their patient COVID-19 condition. The objective for this project are: first, to develop a wireless pulse oximeter for patient COVID-19 use. Second, to monitor oxygen level and heart rate of patient COVID-19. And third, to design IOT circuit of pulse oximeter. The significance for this project: first, as an important part of a COVID-19 survival kit. Second, can monitor oxygen levels in all patients who tested positive for COVID-19 at home. Third, make the doctor easy to detect and get informed about their patients' oxygen levels. Fourth, ensure the immediate action to be taken if the COVID-19 patient's oxygen levels number falls become lower. And lastly, prevent the patient's condition from worse. Now, I will show you the demo for this project.
After we place our finger on the oximeter sensor, we can see the values of heart rate and oxygen level displayed on the demo dashboard. At the device, it will display the last activity that include the latest value of oxygen level and heart rate.
That's all from me. Thank you.